Hello everyone, my name is Makia Miller and I will be taking you through this cultural competence training module that is targeted towards social workers servicing the older African American population. In this training, we will cover the economic status, health status, social supports, cultural values regarding aging, and barriers that older African American adults face. I will also discuss recommendations for how a social worker could approach a client from this background. I would also like to make note that the information in this training is specifically research-based and not biased or opinionated. Sources will be available orally as the information is presented and at the end of the training in a slide for viewing. According to an article from earlier this year with the Pew Research Center, there were roughly 48 million African Americans in the United States. 12% of that number was categorized as 65 years and older. This percentage of people are increasingly experiencing financial and healthcare disparities and lack access to resources compared to the white 65 and up population. These issues have a direct impact on health outcomes in the African American community. African Americans face many more challenges economically than other races. Research shows that the percentage of older African American adults living in poverty is about 10% more than white older adults. Due to inequalities, unfair wages, and job segregation in the workforce, many retired African Americans report having a significant lower retirement fund. This means that employer-sponsored plans such as a 401k or an IRA were likely not had. It is important to understand that housing instability, food insecurity, and trouble accessing expensive medications may be the reality for your client. Did you know that African Americans are more likely to be diagnosed with chronic illnesses or diseases than other races? Based on a study conducted by the BJC Healthcare, African Americans have higher rates of cancer diagnoses and deaths. They are 60% more likely to be diagnosed with diabetes, and they are 30% more likely to be diagnosed with hypertension. Also, Alzheimer's is another disease that is very prominent within the African American community. While African Americans have higher percentages for these illnesses and diseases, they are less likely to receive a proper diagnosis from a healthcare provider in a timely manner. This is due to unequal access to care, medical mistrust, and medical discrimination. Older African American adults have a high trust in family, church community, and other informal caregivers. In comparison to the population of white older adults, African Americans are less likely to transition to long-term care facilities due to the strong family support systems that they have in place. It is important to provide resources for not only the older adult, but for the caregivers as well, due to higher levels of caregiver burden that the African American community faces. In African American culture, older adults are viewed as strong, resilient, and respectable. Older African American adults think of aging as a privilege in another phase of life that is to be received with an open mind. Despite this thinking, many older adults in the community do not seek outside assistance due to factors such as medical mistrust, the need to be independent, and wanting to only have help within their family or within their church. Tailoring your plan for the client around their cultural beliefs will make it easier for you both to reach any treatment goals that have been set. There are many barriers that the African American community faces when it comes to different services. According to the National Library of Medicine, These barriers can include disregard of cultural values and poor experiences within the healthcare system. Some other barriers include financial limitations, transportation issues, and lack of referrals to specialty care providers. When thinking culturally competent, it is important to recognize the barriers that are currently in place for your client and find a plan to eliminate them. When it comes to working with the older African American population, there are many approaches that you may take as a social worker. One example would be to build trust with the client by being culturally responsive. You can do this by acknowledging racial injustices and disparities, taking a faith-based approach in planning, and incorporating the client support systems such as their family or their church community if they wish. By building this trust with the client, you can help increase positive health outcomes. Another example would work in collaboration with resources in the client's community. This can be your client's church, a senior center, or associations in the neighborhood. Evidence shows that integrating services that the client trusts, it improves their engagement, which leads to better outcomes. In conclusion, I would like to highlight the importance of providing quality service to this population. Older African Americans have endured so much throughout their lifetime, from social injustices to deep-rooted racism. Despite the hardships they have suffered, they still remain strong and resilient within their faith and their culture. Being a social worker servicing the African American community is a role that requires respect and focus on providing equal care. Recognizing the economic challenges, health disparities, social supports, and cultural values will aid you in being understanding and acting with compassion and humility.